Hello and welcome. Thank you for taking some time out of your busy day to sit down and review with us. My name is Liz Lanus. I'm joined by my colleague Julia Gessick, and our goal today is to talk about making connections in the dialysis unit.
So we're going to talk a little bit about team approach today and how patients can participate in care and life planning. So dialysis providers have a requirement via the CMS conditions for coverage to meet with patients and review certain topics. These topics include things like current health status and medical condition, dialysis prescription, blood pressure, and fluid management needs, labs, immunization history, and medication history, anemia numbers, including administration of medication if helpful, renal bone disease, support a dialysis dietitian can offer, and support a dialysis social worker can offer. And they also have a requirement to meet with patients and review topics such as dialysis access type and maintenance, patients' abilities, interests, preferences, and goals, preferred modality, whether that's hemodialysis or peritoneal dialysis, and setting, for example, home dialysis, and the patient's expectations for care outcomes, options for transplantation referrals, family and other support systems, current patient physical activity level, and referrals to vocational and physical rehabilitation services. So what steps can we take to inspire patient engagement? We can do goal setting with the KDQOL. We can do rapport building, working on rapport with our patients, motivational interviewing. We can have educational resources that we can review. We can retrain patients as needed for home dialysis. We can also conduct home visits as needed for these patients.
In the team approach, what is included in the patient assessment? Note that internally, some of these are probably going to have different names and may be shared amongst different roles. But typically, the nursing assessments include pre-dialysis, intradialytic, and post-dialysis assessments, current and past history and physical review, fluid status, if the patient is alert and oriented, medication history, access check, fall risk, and pain scale. Dietitians work to do nutritional assessments, diabetes self-management assessments, review of mineral and bone management, cultural, regional, and generational diet factors, as well as subjective and objective data. Social workers review the patient's communication status, ability to read printed materials, advanced care planning, social barriers, support system, and spirituality, cognitive patterns, mental health status, mobility status, living situation, patient identified goals, modality preferences, and suitability for a transplant. As staff, we are trained on some techniques such as teach back, where staff ask patients to explain back to them what you were discussing to kind of gauge what level of understanding they have of what you've been discussing. That is a method that is referenced in the conditions for coverage, as well as techniques like motivational interviewing, where staff may try to make connections by using examples that apply to each patient's real life experience as you get to know each other a bit better.
So when we talk about making connections, how do we continue to be successful in our communication methods? It's never a responsible choice of professionals or patients to try and win the discussions that are being had. This is life-sustaining care, and bias, misinformation, and older information can be really dangerous. So patients in clinics should prepare with questions, intentions, and reflect on their goals. Listen first, intently and completely, not to respond. Be prepared to agree on what matters most to them. Be open to connection. Sit with their feelings and communicate with them. And communicate boundaries. You can participate in care as much as tolerated and desired. If you feel uncomfortable, you do not have to share, but do know that while confidentiality will be respected, you may limit yourself by choosing against sharing certain details. So some examples, what are some hot topic connections in dialysis? Some things that are hard to discuss sometimes are anemia numbers and energy levels, sleep and potassium levels, sexual health and wellness in dialysis, itching and bone and mineral numbers, physical activity and calcium, depression and relationship changes, what different blood pressure medication side effects may be, and fluid symptoms.
Some examples. Why does an IDT team help? Information is going to come to us from people that we know and trust best. Different team members are going to have different backgrounds. Patient facility representatives can explain circumstances to others from their patient lens. Dietitians may be able to better explain body's processes. Providers and nurses may be able to prescribe medications, change prescriptions, or even provide referrals that help. And social workers may be able to connect different signs and symptoms, talk through these symptoms and the feelings that are related to them. Communication acknowledgments and tips. Processing information is going to look different on different people. Some patients may seem very engaged, while some may need to simmer on the information and ask questions later. Some patients may do best by hearing the information multiple times and from multiple different types of people. Some patients who have a relationship with certain staff will feel closer to a particular teammate and will do well to hear something from them versus someone they don't feel connected to. Some patients may be experiencing denial or may appear to be shut down. And some patients may also feel an aversion to certain clinical staff, cultural factors, or different stages in where they are with their acceptance of kidney disease. What non-adherence looks like. So non-adherence can be the process that comes after an opportunity for missed connection. So you can review here. It may be hard to see. We do reference it in our references slide at the very end, but non-adherence may stem from just missed connections. And so we really want to kind of take a look and be proactive on maybe areas of concern so that we can best support our patients.
So, what steps can we take to encourage making connections with our teams? Some things that we can do are talk with our team about assessment you're giving and how they impact the care we can get by, for example, the 24-hour recall, KDQL 36. Ask questions as they come to you. Get to know your staff and patients. Review provided educational resources, care planning process, and recruiting a patient facility representative to help give your patients the skills and connection they seek by knowing someone else that has felt the same way that they do. And as Liz previously outlined, we do have some resources available that can be downloaded. These are also available on our website. We have everything from can you ever be discharged from a facility, access to care management, a webinar on communication, and things on life planning. So we do really encourage everyone to go ahead and check these out, print them out, and give them to patients.
And that's what we have for you today. Thank you for taking some time to talk with us about making connections at the dialysis unit. We have our information listed below if you have any questions or need any future support. Thank you so much.